In an effort to curb drug abuse, a redesigned prescription drug monitoring website will launch in Wisconsin tomorrow. News 8's Eric Jacobson spoke with medical experts today. He joins us in our newsroom with their thoughts on these changes.
Mike, doctors say nearly 80% of heroin users began by abusing prescription drugs. Now, as part of the HOPE agenda that was passed in Wisconsin last year, numerous changes are coming to what now is called the Enhanced Prescription Drug Monitoring Program. The first is a redesign of the website, with the goal of becoming more user-friendly for pharmacists and doctors. Medical experts say the changes will put Wisconsin at the forefront at stopping drug abuse before it ever happens.
Unfortunately, more frequent than you would think.
Doctors at Gunderson say the current prescription drug monitoring site has been critical in getting painkillers like hydrocodone out of the wrong hands.
We almost had a 30% reduction in those, and I think the PDMP was a big component of that.
But as much as it has been helpful in tackling abuse,
It had a few deficits.
the current website needed updating.
The old one was almost like an Excel spreadsheet.
The new enhanced prescription drug monitoring site has a number of improvements, both in design and features.
If a patient is getting a sedative and you're prescribing a narcotic, it's got a history alert that comes up. So it actually informs the prescriber to watch out that this may be over sedating.
If you're seeing a patient in the emergency room or the hospital, you'll be able to now see that that patient has an agreement with another provider, and that will be very helpful information before you would consider prescribing controlled medications.
Beginning April 1st, a number of changes will also take effect. Providers and pharmacists will be required to check the database before prescribing, and the time required to enter the prescriptions into the database will be reduced from 7 days to 1.
It wouldn't be uncommon for a patient to maybe fill a prescription one day at one pharmacy, 2 days later at another pharmacy, and maybe even another pharmacy, and that data may not become available right away until it's maybe too late. So the more prompt reporting will definitely be a helpful tool.
Experts agree these changes will help better identify those abusing prescriptions.
Hopefully this tool that we have will help show us the patients who are legitimate and honest and using their medications as prescribed, but sort out for us the patients who are using these medications illegally or irresponsibly.
Now, police departments will also be included in the new changes to the program. If law enforcement finds someone using prescriptions illegally, that will be entered into the system for doctors and pharmacists to see.
Thanks a lot, Eric. In addition to doctors and pharmacists, nurses and drug counselors will now be able to check prescriptions on that new site.